Hello to the world. Today we are talking about reproductive health unit, and I'm taking you straight to reproductive health unit. And I'm going to be talking about infertility, both in female and in male. And I want to let you know that infertility is inability to conceive after 12 months of unprotected sex, and your partner fails to get pregnant. That means there is a query and a question that maybe one of you is infertile. But in this case, I want to let you know that there are predisposing factors to infertility, or factors that are related to infertility, both in male and female. I want to let you know so that some of them can be avoided and your fertility can be regained. Or some of them might not be avoided, but they have happened in a coincidental way that we can't control it now. But I want to first bring it to you so that you can get the concept of what I'm trying to bring up. In males, infertility is related to sperm production. That's one of the causes. Sperm production. Sometimes you might be producing low amount of sperms. So if there is low amount of sperms, realize that it will be hard for you to pregnate, because by necessity you are required to produce more than 60 million sperms for a woman in one ejaculation in order for her to get pregnant. So if you produce less than that, there is a high ability that those sperms will be destroyed as they keep moving on the way towards the egg for fertilization. So they will be destroyed before they reach the final destination, because of the acidity and other factors along the reproductive organ of a female. Then you look at no sperm production. Some people are unable to produce sperms due to other factors, but majorly that can be congenital. They are unable to produce sperm. Then also we are looking at the sperm abnormalities. Sperms can be abnormal in a way that maybe their shape, their head, their general makeup, the short tails, the double tails, the bald head, and those could be the related factors when you talk about sperm morphology. Then you talk about the sperm motility. Some sperms are unable to move, they are unmotile. So in that case, because they are going to travel from the point of deposition to the point where they're going to meet the egg. So if they are unable to move, they will also be one of the factors relating to infertility. We also talk about testicular damage. Now, in that testicular damage, you realize that maybe tumors are developed in your testicles. Now you are unable to produce sperms, or sometimes trauma or injury. If you've gotten an injury to your sperm, actually to your testicles, it will be unable for you to produce sperm. And of course, certain infections that can also affect your sperm production, like otitis, which is an inflammatory condition of the testicles, and other inflammatory conditions that may lead to testicular damage, like other autoimmune diseases. Then not only that, we also find that obstructions of the sperm can be relating factors to your inability to be fertile as a man. So the obstruction of the sperm could be due to recurrent STIs, or sexually transmitted infections, which may cause wounds formation along your urethral lining or even up to the epididymis, whereby if those infections keep surfacing and disturbing that urethral lining and your reproductive organ, you realize that there will be always scar formation, and those scars can lead to blockage of the passage of the sperms. Then, of course, we also have what they call the congenital abnormalities, whereby you realize that someone might be having no vas deferens. That means someone might not be having what they call the epididymis. And of course, maybe someone also has gone through successful vasectomy, can also lead to infertility. Then, of course, other infections that can also prolong along the urethral lining also can lead to infertility, as I told you about the scar formation. Then, of course, you also talk about lifestyle. Certain people are exposed to certain lifestyles that have affected them in their productivity. One of the lifestyles is smoking. Smoking, production of certain toxic substances from smoking, like tar and nicotine, also affect your reproductive health. Then, of course, looking at excessive consumption of alcohol. Now, excessive consumption of alcohol has a very big impact in your manhood, because first of all, you come when already you know the effects of alcohol, CNS depression and all that come in play, and always reduce libido, and of course it can affect you. Then, of course, to certain people it is obesity. They are too obese, and in a way that it affects how they normally function in production. Then we talk about exposure to heat, a frequent exposure to heat. Remember, sperms need to be protected at a certain level and certain temperatures. So overexposure to heat majorly, maybe when I talk about if you're a man who's doing chapati making, you shouldn't do it for a longer period of time, because the level of your heat exposure is quite high. So it puts you at a risk of getting this infection. Of course, that is occupational exposure and occupational hazard. Then, of course, we are talking about exposure to certain chemicals like pesticides. Can also have effect, of course, with the reference of heavy metals being taken into you, like lead, can also affect your reproductive system. Then, of course, we are looking at other medical conditions like diabetes. We're looking at diabetes can also have effect in you. Then, of course, looking at autoimmune diseases also having an effect in you as a man. Looking at liver diseases, because you realize when during production of sperms, you realize this what they call there are certain proteins that are produced from the liver. Remember, liver takes a bigger portion of the production of proteins. So there are certain proteins that are necessary for the production of sperms, like the androgen proteins. So in that case, that if the liver is having an infection, so the maturity of the sperms can be affected. Then, of course, you also have what we call the anabolic steroid use. Someone has been on anti-steroidal use for a longer period of time can also have an effect in the fertility rate. Looking at certain medications, if you've been taking certain medications, they also have an effect in that case that they will also affect you in your reproductive cycle as a man. Then, of course, looking at what they call the varicocele. Varicocele is dilatation of the veins that are always found around the testicular region. If those veins dilate, there will always be higher levels of temperatures rising because of high blood supply there, also causing testicular damage and all that. So relating you to failure in your reproductive health acquisition as a man. Not only that, we also see that infections that you have allowed to always prevail along your reproductive system can also affect, for example, overexposure to sexually transmitted infections for a longer period of time that are not treated, in this case, will also lead to infertility at the end of the day. Looking at other conditions like urchitis, and of course, looking at conditions like prostatitis. Prostatitis is an inflammatory condition of the prostate gland. Then, of course, you also have things like epididymitis. Epididymitis is an inflammatory condition of the epididymis. So in that case, we realize those can be the relating factors to infertility in males. And evaluations can be made in males in order to come up with the conclusion of what could be relating to this cause. Because I told you, some of them can be avoided and you can regain your fertility, or some might not be avoided. For example, the issue of lifestyle changes like smoking, obesity, and the stress. Then, of course, looking at alcoholism, excessive alcoholism. Those ones can be fixed and you can gain back your fertility at the end of the day. Then, of course, not only thinking about that, I said you now are going to deal with what they call evaluation. Evaluation, that means these are the laboratory tests that can be done in order to identify what could be causing the infertility in this case. So we realize that we have the first golden method that we do is what we call the semen analysis. Semen analysis is one of the golden standards as males that we can use in order to come up with a diagnosis that will give us alignment of what could be the cause of your infertility. Of course, we also have what they call the hormonal profile. We can do hormonal profile where we are looking at the follicle stimulating hormone, the luteinizing hormone, the testosterone levels, and the prolactin levels. Of course, with increased levels of prolactin, it suppresses other activities of other hormones that can also result in infertility. Then, of course, we can also do what they call the scrotal ultrasound. We can do a scrotal ultrasound that can help us to come up with with diagnostic features that we can be able to rule out when you are trying to diagnose what could be causing your infertility. We can also do what they call the genetic testing, where we can, when requested by a doctor, we can go ahead and do genetic testing and come up to know what could be causing this kind of infertility in you. Then, of course, assessment of infections. We can also do an assessment of infections. For example, we can do urinalysis. It's also primary to give us what could be causing your infertility. Then, of course, you also have to rule out other obstruction factors which could be resulting into this. So with that, that comes to an end of what I wanted to share with you today. But I'm hoping to give you a highlight on seminal analysis, hormonal profile, and assessment of infection. So in our next video, I'm going to bring to you urinalysis, seminal analysis, and hormone profile analysis. So for today, thank you for attending. Meet you once more. Thank you. Global Health Science Educational Series, taking us far. Thank you so much. Thank you so much. Before we go and talk about evaluation of infertility in males, like the laboratory diagnosis of infertility in males, allow me bring to you the predisposing factors of infertility in females. And one of them we talk about is ovulatory disorders. Now, ovulatory disorders can be either maybe PMOS or PCOS. You can call them polyendocrine metabolic syndrome, or you can also call it polycystic ovarian syndrome. Of course, you also have what they call the early menopause, can also be a resulting factor, or can call it premature ovarian insufficiency. Of course, you also have what we call the hormonal imbalance in females, also due to irregularities in FSH LH and prolactin, of course, with thyroid hormone. We're also looking at fallopian tube blockage, which could be resulting from infection like PID, STIs, pelvic inflammatory surgeries, and of course, tubal pregnancies. Of course, looking at FAR, we also talk about endometriosis, which is development of an endometrium lining in the outside of the uterus. Instead of the endometrium lining being inside, there will be another development of another endometrium lining similar to the endometrium from the outside part of the uterus, leading to inflammatory conditions and all that. Then, of course, we talk about also fibroids, which is uterine abnormalities. We talk about fibroids, then of course congenital uterine defects. We also have what they call the intrauterine adhesions, whereby maybe one way or the other, one wall of the uterus or the other one coming together, or just a long adhesion where the uterine walls can come into contact, hence obstructing this normal reproductive system. Of course, you also have what they call the cervical status or the cervical factors, which are majorly maybe the presence of thick mucus along the cervical os. Then, of course, maybe cervical stenosis, whereby the cervix is majorly blocked, hardening of the cervical os, whereby the sperms cannot be able to penetrate to cross the other side due to the hardening of the muscle or the tissue along the cervix. Then, of course, we also know that age, when a woman is still young, she might not be able to conceive due to her young age. Of course, the hormones are not yet active enough to exercise the exercise of reproduction. Then, of course, looking at again later ages of about 45, certain people set into what they call menopause. Of course, that also affects the fertility of a woman. Then, of course, looking at lifestyle, also females who are exposed to certain lifestyles can also affect them. Of course, looking at maybe like obesity, as I told you, alcoholism, and other factors like stress can also relate into infertility in females. Then for that, allow me settle down to bring to you finally laboratory diagnosis of both male infertility and female infertility. In other words, laboratory diagnosis of how we can come up with a conclusion of what could be causing your infertility. Thank you for watching this one. Wait for the next one. I encourage you to subscribe on my YouTube so that we can be able to get these latest updates. The advantage of subscribing is that every time we release a video, you'll be able to see it and be updated on time. And tonight, this one is the one I brought out, but next one will be super cool and super interesting. I would encourage you to continue subscribing to that YouTube channel, to my YouTube videos, and it will build up. And always, if you find anything deviating, I will always allow you to comment so that I can use it to change, to advance, and to progress further with the production of more videos. Thank you so much for attending. Love to see you. See you again once more. May God bless you.